This is the Lone Crater YouTube. We hope this video helps.
You begin by sanitizing. Wash your hands thoroughly for 20 seconds, then dry them on a clean towel. Next, inspect the eye patch. Check the adhesive edge for lint or damage so it will stick evenly. If you wear contacts, remove them now. If you have long eyelashes, gently trim or brush them back to avoid trapping lashes under the patch. Once done, peel a small corner of the backing. You want a controlled start so the patch aligns with the orbit. You close the affected eye and hold the patch by its edges to avoid reducing tackiness. Position the center over the eye socket. Aim the soft, cushioned area where eyelids meet, not on top of the lashes, so you avoid pulling. Lower the patch onto the skin, then press the adhesive rim down in 3 sections: brow line, outer corner, and along the cheekbone. This creates an even seal. Make sure you can blink comfortably beneath the pad. Adjust immediately if it feels tight or misaligned. You finish by testing comfort. Blink, move your eyes, and note any pressure points. If there's pain or visible gaps, peel and reapply, adjusting the edge placement for a better seal. To remove, lift the adhesive edge slowly and pull toward the nose to reduce skin stress. Cleanse the skin gently afterward to remove residue. If you experience redness or itching, stop using that patch, switch to a hypoallergenic option, or consult a clinician. One troubleshooting tip: persistent leakage or vision issues means seek professional advice.
Thanks for watching. Consider subscribing if we helped you.